In this video, we're going to talk about how to stop massive bleeding on a junctional wound for the axillary artery inside the armpit and here. There's two locations. One is in between the shoulder and the chest right here, and the other location is underneath the armpit. It's a little bit more difficult to do it underneath the armpit, so I'm going to teach you how to do that first. Again, I will make more videos describing each detail as to why we do it the way that we do it. In this video, I'm just going to give you an overview process of this massive bleeding. So just like in the femoral artery, all right, we have to have pressure, we have to have hemostatic, and we have to have gauze and a pressure bandage, okay? First thing is we're going to cut around outside of her injury. If there's blood here, okay, massive bleeding. If it's here, we're going to cut here. But for this instance and scenario, we're going to be underneath the armpit. Cut away, see what we're dealing with, and immediately apply pressure. I'll use this knee to show you so that you can see better. All right, we're going to apply pressure as much as possible up inside of her shoulder because it is massively bleeding. All right, remember that the first step is getting your hemostatic ready. Okay, the hemostatic needs to go towards the heart. Okay, everything we put inside the wound, always we go towards the heart because that is the source of our bleeding. All right, so like in the last video, I'm going to be simulating hemostatic because I don't want to open this. It's for training purposes. Okay, so you're going to wrap it around your finger just like this. Okay, and then you're going to stuff the wound with hemostatic. Okay, I'm going to put a little bit more hemostatic in there. And if it's, you don't want to have it unrolled. Okay, I have it unrolled because it used to be a roll and I didn't roll it back up. Okay, but you never want to unroll anything. You want to use control. Okay, for example, here's a little bit of rolled up gauze. You want to have control over it, right? So you're putting it inside and you're pushing more. See how you have control over the amount that you have, right? If it was all undone like this, right, it'll just get in the way. It won't be clean. It won't be efficient. All right, you just want to use a little bit of gauze, unroll it, stuff it back in. Unroll it just a little bit, stuff it in, just like that. All right. Remember, you want to fill up the whole wound with regular gauze. As much gauze as possible. Okay, that is the point. After hemostatic, you put as much gauze as possible inside of there towards the heart, because that is where our bleeding is from. At this point, you will create 3 to 5 minute pressure with your knee, just like this. Okay, you need to pull the body towards you. Okay, at least this side needs to be pulled towards you because there's not easy downward pressure like all the other wounds that you can do. If the wound is here, you can just put your knee on top of here. Okay, but because it's inside the armpit, you have to kind of pull the body towards you and stop that massive bleeding. 3 to 5 minute pressure. Of 3 to 5 minutes, you need to apply this pressure. After 3 to 5 minutes, you need to check to inspect it. See if it's still bleeding. If it's still bleeding a lot, you need to apply that pressure 3 to 5 more minutes, as much as possible. Okay, 3 to 5 minutes has passed by. You checked. And the bleeding has lessened or stopped. So you get your trusty pressure bandage so that it can maintain pressure. Remember the different parts of the pressure bandage, okay? So at this point, what you can do is you can ask her to sit up, hold that wound in place as you sit her up, okay? All right, go ahead, sit up. So she has her hemostatic and her gauze that she's holding in her armpit with the massive bleeding and applying pressure to her wound. I have sat her up. Now you can use your elbows, you can use your hands, you can use your knees, you can use your thighs, whatever you need to keep her up. If she's unconscious, you're going to have to maintain pressure while you're sitting her up as well. Okay, so now the next step is you already applied hemostatic towards the heart, gauze towards the heart because that's the source of our bleeding. You've applied 3 to 5 minute pressure, okay, and the bleeding has lessened. You sat her up. She's maintaining pressure with her hand while you get your pressure bandage ready. Okay, so now you need to apply the pressure bandage. Remember to put the pressure bandage, the pad needs to be over the wound, okay? It needs to be as wide as possible and as tight as possible, okay? Now, the shoulder is a joint, and the pressure bandage will try to slip down from the joint, okay? So you need to be aware of that, okay? The next thing is I'm going to make an anchor, okay? The anchor will go as an X across her back, like this, okay? It's just for an anchor. You're not doing anything to the shoulder. You're just anchoring this pressure bandage so that it doesn't fall or it doesn't lose pressure, okay? You want to make it as tight as possible, okay? It needs to be as wide as possible as well. Okay, so here's where the tricky part comes in play. Okay, I have stopped where the clip is underneath her armpit, and it's going to be very inconvenient for her when she tries to lower her arm. Okay, so when she tries to lower her arm, that clip is going to be sticking into the wound and into her shoulder, into her armpit. So it will be uncomfortable for her. But what I tell her is that she rather be alive and have an arm and a shoulder rather than the pain that she's in. Okay? So with all of that, the pressure bandage actually stops the bleeding and maintains that pressure. Okay? That's how you stop massive bleeding on a joint for the auxiliary artery.